Good morning, everyone. Happy Memorial Day weekend. As always, I want to thank our chamber team, Vicki, Nina, and the entire team. They really put on some great programming for all of us. We had a great virtual lunch yesterday for those who were able to join us, and look for more of those coming. Today, we're excited. Every meeting we have here, starts with safety and what we're trying to do to keep our people safe as they come to work, especially with more folks traveling down this weekend. I think it's very timely presentation. So very quickly, I just want to thank Freeholder Pierson and our Cape May County Health Department, led by Kevin Thomas over there, for taking some time today to join us. And I know they each have some opening remarks, and we have some questions as well. So with that, Freeholder Pierson, I will turn it over to you. Thank you, sir.
Okay. Well, good morning, everybody. It's a beautiful Friday here. I don't know, it's supposed to rain off and on here today, but weekend looks pretty good. And it is, as I said, Memorial Day weekend. So we need to all have the first chance here to breathe some fresh air and get outside a little bit and but safely get outside. I'll move out of the way for a second here and try to explain this background. It's called the Missing Man and Fallen Comrade Table. This is the corner of the administration building where we all have our freeholder meetings at. And the table is here to the left, and the chair, the missing man chair, is to the right. And they both have meaning and ceremonies that are done for veterans, fallen veterans, and deceased veterans, and those missing in action. So I thought I'd put that up as a background today. Just instead of you watching my refrigerator, I'm not a senator, so I don't want to have a refrigerator behind me, if you know what I mean. So good morning again, as I said, and I hope that you're all staying safe this grand and glorious weekend that we have ahead of us. I'm going to make three brief points. First, the health department under Director Thomas created a COVID task force of municipalities, health agencies, emergency managers, and freeholders about a week prior to Governor Murphy's 9 March declaration of a health emergency in New Jersey. And that task force continues today. We meet weekly online. We were probably one of the first counties to step up and do that. And I want to give all the credit to the county health department and all the people working there. They did a fantastic and are doing a fantastic job. Second, after the president's national health emergency declaration on the 13th of March, with the coordination of Freeholder Director Thornton, I directed our county Crest Haven Nursing and Rehabilitation Center to close to the public. No more people. Don't bring any more people in as residents until we see that the health is cleared up here in the county of Cape May. I worked with the guidance with Director Hess of the Crest Haven, and she and I went over things. She shut the facility down on the 14th of March. She introduced some more guidance, and we're following the CDC protocols. And I'm happy to say, as of today, knock on wood, that we have absolutely no COVID residents and no COVID staff in that facility. So we're very proud of our people that are working in Crest Haven. And they've been getting a lot of support from county health department, as well as our own OEM getting supplies, etc. Finally, a third one, 26 April, Freeholder Vice Director Len Desiderio and Freeholder Will Morey, they became co-chairs of our Cape May County Business Recovery Task Force, and they published the Cape May County-wide Recovery Initiative. Now, the task force was made up of people from all venues of business and sectors within the community from different areas around the county. They worked hard at that. They put many hours on it. They did a lot of Zoom chats, etc. Got that puppy together, and we published it. And it's a gradual slope to bring our county back to life. And hopefully through, by July, hopefully we'll be humming. Right now, I'm sure Kevin will go over a lot of the figures and show you some things. And I think we're on a downward trend here. I think the figures are positive. We do have one glitch in the long-term care facilities, but Kevin will cover that. But basically, that plan is our goal to make sure that our community is safe and healthy as we open it up and as we expect visitors to come into the county. Throughout this whole process, we were not allowed to keep second homeowners out of the county, and they lived here. They've been a part of our community now for the last 3 months at least during this COVID. They escaped New York, they escaped Pennsylvania, and came down here. So they've been among us. It's nothing new. So with that, I'll turn it over to Kevin Thomas, the Director of Health.
Okay, well, thank you and good morning. I just want to let you know that this is a collaborative effort among many different officials, including state, of course. You go from federal, CDC gives us many guidelines on exactly what we're supposed to do. Those guidelines are sent down, massaged a little bit by state organizations, the state health department, and rolled on down to the local health department. I'm fortunate to be working with a good staff that is responsive to this outbreak. And one thing you should keep in mind is that responding to communicable disease in the community is nothing we just started. This is something we do on a day-to-day basis, whether we're having a pandemic or not, whether there's a hepatitis outbreak, where there's a norovirus outbreak within a long-term facility, influenza, we do the influenza administration and vaccination throughout every single season. We're fortunate enough that we do anywhere from 32 to 40 vaccination clinics each fall, and our public health nurses are diligent, and we have done such a good job with our influenza program that we've been on the state honor roll for the last 3 years, and I thank my public health nurses and all the staff that go along with that. So in our response to COVID-19, there are some main factors that we are going to be talking about today. Some of those main factors are, number one, the social distancing, some of the things that have been implemented for that, your personal protection equipment, those aspects, and also what is available both online and hotlines that you can get information. And we've been putting that information out. I mean, you can go to our website every day since this started. We've been putting out all the positive cases. We track all the positive cases that come into Cape May County. We respond to them through contact tracing with our nurses. We're fortunate enough that we have the amount of cases, I should say, maybe the second least amount of cases within the state that we can do all our contact tracing. You've heard a lot about contact tracing. We'll talk about that later, but I just want to welcome you, and we're here for you, and we're on top of this as much as possible. Pandemics is something new to all of us, so thank you for inviting us.
Thank you very much. I appreciate your opening remarks, and we will get into these questions that have been submitted to us in advance. And while we're going through this, as we said, we know that you are going to have some questions. So remember that we'll use the raised hand feature. So let's get started with these pre-submitted questions. How has social distancing, wearing of masks, and hygiene measures enacted by both state and the county had a significant impact on the spread of COVID-19 in Cape May County?
Well,
Kevin?
yeah, okay, well, it's clear to see that the number of cases in the community in Cape May County are much lower than the state. Of course, we have less of a population, but the one thing about that is not just the geographic aspects of Cape May County, it's the type of housing that we have. I mean, we don't have a whole lot of multiple types of housing, communal types of housing where people are on top of each other like New York City. So we're fortunate in that way. And people abiding by these social distancing measures and the mandate to stay home and make sure you're 6 feet away have really had a significant impact on lowering the the rate of this COVID spread within our county. I mean, right now you have 555 cases. You do have 46 deaths, unfortunately. However, keep in mind that 30%, 33% of all the cases of that 555 are in long-term care, where I talked about that communal type of living. Also, all but 10 of the deaths are in long-term care. So you have 46 deaths, 36 are in the long-term care. So in the community itself, we're not doing so bad. I mean, even if you subtract a lot of the people who work, the staff who got COVID within those long-term care facilities, you start subtracting those numbers, and it looks even better in a community type of spread. I mean, there's hope there, and our numbers are not looking as bad as they were 2-3 weeks ago. So things are definitely not just from state level down, but especially Cape May County, it's looking a lot better. Thank you.
Okay, thank you. What is being done to protect the community and long-term care in the assisted living facilities?
Well, the key to protecting the general community, again, is that social distancing, the proper hygiene, the wearing of masks, and there's a lot of educational things that we put together to get out into the community. And we do have a social distancing ambassador program that we'll talk about later on. However, the one thing that we do is the contact tracing. And contact tracing is the key to stopping the spread of this virus. So let's talk to Mary Ty about what contact tracing. She's our Assistant Director of Nursing, and she can tell you what contact tracing is.
Yes, hi. So in the long-term care facilities, we certainly are testing. Testing in the beginning was a little slow and difficult to come by, but we are now testing on a weekly basis within those nursing homes. We're testing the residents and staff to get baselines, and then continuing to test the negative people to see if we can identify any positive contacts or positive people before they could become symptomatic. And that's the highest rate of when the spread happens, is when they're symptomatic. So we're doing a lot of testing. We are notifying the facilities. We're in daily contact with the director of nursing and the nursing staff there within the long-term care facilities, and talking to them, talking about their positive residents, their positive staff, talking to the staff. We call them, we speak to them directly and find out who their contacts are within the community. And then the facility is mapping what their schedule was and who they've come in contact with within the facility. And then we start testing them to see if they're going to come up positive. Because if we can identify them early before they get too symptomatic, we can isolate them and keep that spread from happening. So that's how the contact tracing is happening within the long-term care facilities. And then again, out in the community, we are contact tracing. Anybody that comes up positive, we are notified, we call them, we find out who they have been in contact with. And close contact is considered closer than 6 feet, longer than 10 minutes, in a confined area. That is your highest contact and ability to become positive, is when you have that close talking, face-to-face contact. We do know that, touching surfaces, that is very minimal of the spread. Just walking by someone quickly, that's not how it's happening. It's that talking, sharing utensils, someone who lives in your household. Those are the people that we identify. And then we give them guidance also. Along with the positive person, we're asking those people to stay home for 14 days, monitor themselves for any symptoms, And then if they become symptomatic, to contact us, to contact their primary care physician, and go out and get tested and see if they're positive. And testing is happening widespread now throughout our county. You do not just have to be symptomatic to be tested. So there is plenty. You have your urgent cares and your complete cares, and a few doctor's offices out there that are all doing testing. So, and then again, within the nursing home facilities, they're all contracted with laboratories and are doing plenty of testing. So that's how we're doing our contact tracing.
One thing I'd like to add to that is that you've heard a lot about the state and rolling out this contact tracing throughout the state of New Jersey and hiring all these people to do contact tracing. The problem with North Jersey is the nurses and all the health departments who are doing the contractors, it could not keep up with the amount of cases that they had. They have thousands of positive COVID cases. They couldn't reach out to everybody and make sure they're quarantined. So that actually fell to the wayside in the northern county. Down in Cape May County, we're fortunate that we didn't have as many cases, and we're able to do every single case and do all the contact tracing down here in Cape May County. So we're fortunate for that.
And if I could jump in here too a little bit, because it was focused a lot towards the long-term care facilities. We took about, I think we did roughly 30 steps within our facility to shut it down and make sure that the employees, et cetera, were being cared for and checked on. That was one of the first things we set up. When those employees came to work in our long-term care facility, they were tested every morning. They were asked a series of questions. If they woke up and they did not feel good, they called out sick. So we set up some stringent measures right away. All of our employees work for the county of Cape May, whereas many of the long-term facilities out here in the county, those people have 2 jobs or more. They work in different industries because of the cost of living, et cetera, and raising families. So they bring a lot in from the outside community into the homes, and they were not being tested as they came in every day. So I think that's part of the problem that we have out there in the long-term facilities. We've done an excellent job here in the county trying to keep on top of them and trying to provide them all guidance. And then just recently, the state is now more involved, and they're sending teams down from the state level, and they practiced or set up practices with hospitals to come in and test all these facilities. So I think that sooner or later, this bug in the facility is going to come to fruition, and it's going to go. It's going to be taken care of, I pray. So
Okay. So I'm just going to ask one quick question that came in on the chat on the subject of contact tracers, and that is, do we have enough if we have a spike with the increased population during the summer months?
So, currently right now, we're able to manage if a spike happens. This is a 24/7 operation. And, we have a nurse that's on call at all times. We've all been working pretty much 7 days a week through the weekends and stuff like that doing this. So we've been able to manage it. If the spike happens, we will be able to manage it. We have resources available to us. Other nurses, we have our MRC group that volunteers that are made up of nurses and physicians and different people. So we can tap them to come in and help us. It wouldn't be too hard to be able to just access them very quickly and bring them in and set them up and give them a role to do and help us manage the information.
All right, the
Okay.
other part of that is the state is using and they're purchasing an online software to manage this contact tracing. They're also assigning certain contact tracers to each health department. So we expect to get contact tracers assigned to Cape May County from the state.
Thank you. So the next question is, can you explain what the graphs on the county dashboard show?
Okay, so if you'd like to see graphs, a lot of people like to see graphs of the numbers, and I know in the Herald they're showing graphs of numbers that come in for positives and deaths and community and long-term care. We also put together our own little dashboard, and if you go to cmchealth.net and click on dashboard, you will find these types of graphs there. The first graph you're looking at is the confirmed active cases, which means sooner or later, if you're positive and you're recovered, you're going to go off of the radar, meaning this is what's happening right now. These are the people in your neighborhood, your municipality, who are actively under quarantine. And you'll see their stacked graph. The stacked graph means that the brown portion of that is the long-term care, and the orange portion would be the community active cases. So what you're seeing is just the active cases right now. So you see that Avalon has nothing. I mean, you do have Lower Township. Why does Lower Township have so many? Because they're long-term care. They have multiple long-term cares down there. They got North Cape, they got Victoria Manor, and you also have assisted living centers down there. So theirs looks worse than it is. I mean, and plus half the staff probably live in Lower Township. So that's what you're seeing there. So that's what that graph represents. Next graph. Okay, this one is all the positive case on a daily basis. So if you look at a specific date, you can look at the best and the worst. I mean, if you start looking at when this thing really hit, it came into Cape May County on 3/18. 3/18, you had a case one, and you see the rise and where it started to get into the long-term care on April 5th. And you can see 14 popped up. And the problem, again, is once it gets into long-term care, it spreads like wildfire and it's hard to put out. So you can see the long-term care continues throughout that point. And then you see the spike. There's a big hump as far as up to 419 total cases. And the real, we were like 2 months, really a month, 2 weeks rather, behind New York City. So that's where you see where New York City made a stop to drop, started to drop, ours started to increase. They're around 429. And then you have, in the beginning of May, we have this large spike, and it's gradually starting to move out. So, I mean, it has this little bleeps. It's like a little roller coaster, and it's starting to move out gradually. Next slide, please. All right, now we have our pie charts. It kind of breaks you up where who's getting this virus. You see that the total confirmed cases, and it's broken down by age. Of course, you would expect that over 65, you're going to get a high percentage, but it didn't just affect the over 65. There's a good portion of 41 to 65, and there's another good portion of 18 to 40. So it's fairly even distributed from age 18 on up to and then past 65. So the difference is when you start seeing fatalities right below that is 77% of the fatalities are in the long-term care and 23% are in the community. You'll also see the other pie chart, total fatalities by age. Fatalities is the story. I mean, you don't want to get sick, of course, but the worst case scenario is you get sick and die from this. So the fatalities are those vulnerable populations and the ones that are in those long-term cares. And there's not much difference between male and female there. I mean, 53% male, so it's evenly divided. I think that's the last. Oh, we got one more slide. So if you look at total community cases, you got 67% of them came in, and 33% are in the long-term care realm.
Okay, thank you. The next question is about the Social Distancing Ambassador Program and the 6 Feet Saves program. Can you tell us about those, please?
Hi, my name is Megan Santiago. I'm a health educator here at the Cape May County Department of Health. I'm just going to go a little bit into our social distance ambassadors. Who are they? What are they made up of? And then also our 6 Feet Stays program. So there was a lot of people who were concerned about people not social distancing. Once the weather starts getting nice, everyone kind of puts their guard down a little bit. So we came up with this campaign that we actually took from the University of Rochester. So the program is a positive reinforcement. We're not out there policing. We are just there to be a positive guide and reminder to educate individuals about social distancing and the importance of it, because there is no treatment, there is no vaccine for COVID-19. So not being exposed is the #1 preventative method. So we're just out there reminding people to continue to social distance. And if you're not able to keep that 6 feet, like Mary touched on for that 10-minute extended period of time, like if you're in line for pizza, everyone loves their pizza on the boardwalk, or in line for ice cream, just make sure you have a mask handy just to wear. It's not mandatory on the boardwalk. We're just asking people to be mindful of others. Protect yourself, protect others. And then we have our social distance ambassadors, which is actually made up of volunteers, and also myself and Liberty Kostis, who is our in charge of the Medical Reserve Corps. And they are non-medical and also medical volunteers. So you can be either one. You don't have to have a medical background in order to volunteer to be a social distance ambassador. And the Medical Reserve Corps is actually a nationwide volunteer service. So there's one in every single county in New Jersey, and there's also one nationwide in every state, and also U.S. territories such as Puerto Rico. So in order to sign up to be a social distance ambassador, you can actually go to cmchealth.net, the same website that you can find our dashboard, and you can fill out an application right there. Or you can also call the health department at 609-465-1187. And our volunteers are handing out education materials on how to properly wear a mask over your nose and also your mouth, the importance of keeping 6 feet and social distancing. And when they do hand the materials out, they are using proper hand hygiene. They're washing their hands before and also after handing the bag.
Congratulations. That's a really great program. And there's been so much positive press about that. Really fantastic programs. The next question is a little long, so bear with me as I read it. I'm curious to know, upon reopening, how will the municipalities, county, and state protect the most vulnerable members of our community, such as people of color, homeless, disabled, elderly, and compromised people and essential workers, those without health insurance? These are the people at the highest risk in our communities who will be directly affected by the influx of tourists that we will continue to see over the next few months. Our economy and livelihoods rely heavily on this influx, but this pandemic will not disappear because of our summer season starting. I ask that the leaders in our county and state, you continue to take this into consideration and our vulnerable community members' lives, and not just our economy and livelihoods, as you determine the next steps. Can you comment on that, please?
Okay, I'll start off by commenting. #1, vulnerable populations are the highest priority at the health department. #1, because they're the ones who may pass away from this disease. And the best way, again, the best way for this vulnerable population, and some people don't understand exactly what vulnerable is exactly. They give you an age limit of over 65, those types of people who are obese, diabetes, chronic kidney disease, cancer, liver disease, those types of people. Those types of people need a support system. The support system has to be people who are helping them out. They also have to help themselves out. #1, they can't put themselves in a situation where they are exposed. They can't be running out all the time for the groceries. They need the support system of, look, can my neighbor get the groceries? Can I use some type of a delivery service to get my groceries? They shouldn't be out in the community as much as other people, because this stuff really affects them and could affect, even lead to death. That's the problem. So number one, they should wash their hands often, wear masks, take every precaution as far as distancing themselves, keep away from sick people. That's the biggest part. Stock up on supplies, have 2 weeks of supplies for those types of people. Clean and disinfect all the time, not just once in a while. Doorknobs, handles, avoid non-essential travel. Like I said, if you don't have to get to the grocery store and somebody can take it and you've stocked up for a month or two, that's the best way to handle it. You have to hunker down, as we say in Cape May County, if you have these types of conditions. The other part of that is I'm working with OEM, and the state is working to address where you would put people like the homeless people, where are you going to put them if they're going to quarantine? So they're looking for facilities that house those types of people who may need to get out of the general public. And they're searching different ways of housing those people. And I think they've been addressed in some hotels at this point, but they're working on those. Mary, did you want to comment on that one?
So yeah, of course, we have our vulnerable group, and as Kevin stated, they're the ones that we're focusing on. We're educating them, as far as, trying to hook them up with county resources that are out there, the Department of Aging, social services, what type of services are out there to help them. Kevin had discussed the homelessness group, and I know that the county right off the bat has been housing their homeless people in different facilities, different motels. They've been able to come in, get vouchers, and do that, and they've been working with different groups that work within the homeless population to have those resources available to them. So we are doing that. And then from a business community standpoint, I know, of course, the chamber has been doing their part in educating all of the businesses and getting information out there to the businesses themselves on how they can, the essential businesses that have been out there, they've been running and they've been working in the curbside pickup and all of that, and what they do to protect their employees and the people that come and pick up the food and all that kind of stuff. So, we from the health department are most definitely reaching out to those groups. The chamber's reaching out to those groups. There's all kinds of information out on the CDC website and the New Jersey Department of Health website for each individual group, whether it's a bar and restaurant, hotels. There's all kinds of links out there for the individual special groups. And Vicki, you can give those links. I know you have a wealth of information on your website.
Yes.
One thing I want to reiterate that we're working with the Department of Aging. I want to have Megan jump in because we are doing some things with that.
So we actually recently partnering. Well, we've been partnering, but we're actually going to be doing a little project with Department of Aging. They're kind of taking on the lead with the vulnerable populations, but they wanted to get the education out to their Meals on Wheels and also those who go to the senior center. So we will be dropping off education material so that they can put bags together to hand out to all their Meals on Wheels and also all the seniors that go to the senior centers, just the education material on how they can prevent it and also keep themselves safe. And then if anyone ever needs to call us, they can call us at 609-465-1187, and we can answer any questions. And we will also be giving some bags or masks as well in those bags, so they can cover up if they do have to go out for those essentials.
Thank you. And I'm not familiar. Is Meals on Wheels, is there an age requirement for that program?
Senior citizens.
Senior citizens. Okay, thank you.
Now, Vicki, just one thing, I'll just jump in for just a second on this.
Yes.
They covered 99.9% of everything. But we did shut down our senior centers. That was after we closed the nursing home down. down, I talked with our social services director, and we closed down the senior centers. Then because those people that came to the senior centers relied on meals, we added them to the Meals on Wheels program. And then we opened it up more in general to the public. So our Meals on Wheels, which is delivered by our fare-free employees to the houses for these people, for the seniors in the county, has greatly expanded over this period of time. And we're also out there trying to get a lot of information. This is one way we do it. We do a lot of Zooms. We do a lot of PSAs. We're on radio. We've been on TV. We try to get a plethora of information out there through various media sources. And thank you, Vicki, for arranging this today. You and Nina and Doug for supporting it, because these types of venues are very important to us. So thank you.
You're welcome. And the guidance documents that Mary was talking about are on the Chamber website at capemaycountychamber.com, and just click the link that you'll see with the county proposal that was submitted to the governor. That'll take you to the page with all the guidance documents that we have. And they're also embedded in the proposal sent to the governor. The next question, again, is a little long, so bear with me. As an antique dealer who rents a small dealer booth in Antiques Emporia in West Cape May, my business is similar to those who operate booths at West End Garage, also in West Cape May. We are a gift shop that depend on shoppers who browse and make impulse purchases. Will there be a point when businesses will be allowed to welcome shoppers into their gift shops during the summer? And what limitations or modifications can businesses be expected to implement? Examples being having shoppers wear masks, controlling the number of people in each store to encourage social distancing, cleaning and sanitation expectations, etc.
All right, well, I'll take that on. Number one, you have to think about, I mean, the governor's going to run the show, and he's been calling the shots on a lot of this stuff, the opening rather. And I'm pretty sure that's going to happen in the next couple of weeks, the opening up of businesses and so forth. So there again is a lot of information, not only on the CDC site, the state site, local websites, our site, the chamber site, but there's the one thing you have to do is prepare and know your own business. Number one is contact rules with what type. You have to create a rule within your business. Number one, the rule would be what type of interaction are you going to have with your customer? Is it one-on-one? Can you build something where you're behind a plexiglass to a lot of places have done that, especially in grocery stores. They have plexiglass where their cashiers are. Number two, do you have enough square footage in your facility to have maybe figure out how many people can go in there as far as 6 feet away from each other? So you can figure that out. That's simple math. Not sharing. Simple things you can do is not sharing computers, not sharing your pencils, pens, and frequent cleaning of those things and of your areas. Mask requirements will probably, just like we have right now, you have mask requirements in, if you're going to Home Depot or you're going to your pharmacy and so on, there's mask requirements, and they'll probably start out with businesses with mask requirements until those drop out. So you'll have mask requirements, you'll set up certain rules. Where are you going to take your breaks? Number one, you know, preferably in my recommendation would be take your breaks outside. And if you have a certain room, if you have a general cafeteria where people congregate, you may have to shut that down. They might have to eat at their desk. So there are all kinds of recommendations that are out there on the web. Hand sanitizer stations. I know Ocean City Boardwalk has put up hand sanitizer stations just along the fencing on their boardwalk. So there's different ways of putting that out there and making sure that people are protecting themselves. You will have to hang up maybe signage, put signage out there, how many you must wear masks or you must use hand sanitizer, those sort of things. But I think I pretty much covered most of it. And if you need more information, please go to those websites.
Okay. We have a couple more questions that were submitted in advance. The next one is, are we going to expand our already small hospital for when cases spike in mid to late summer? And how are we going to keep healthcare workers safe?
So the hospital itself, from the very beginning, we've been working very closely with the hospital. The hospital stays in contact with the state. They submit numbers on a daily basis as to what's going on, what supplies they have, what they need. But as far as expanding the hospital had a unit that they had shut down years ago. They have now opened that back up, made all those beds negative airflow, and that would be an overflow that way if they needed that. Also, the hospitals in our area, the 3 hospitals, you have Atlantic Care, Summers Point, Shore Memorial, and Cape Regional. They are talking on a daily, weekly basis, and as we do when we have a shift in the numbers every summer, they talk, and we might have to divert patients to other hospitals. We also still have the convention center in Atlantic City that the governor had set up with the National Guard, and that has a overflow bed capacity. So if we needed that in the summer, we could certainly start diverting patients there as needed. So the hospital does already have a plan that they have taken off the shelves and dusted off as far as pandemic and what they need to do for a possible spike. You have employees during the summer that come in anyways that work during the summer for the extra number of people that come in. And then they always have the ability also to expand using agency nurses that they've used in the past also. So they are well aware of what's going on, and yes, it is taxing on our healthcare system, but they are managing and have some resources at their disposal.
Thanks, Mary. And I see a few folks have put questions in the chat, but I'm going to suggest that you go ahead and raise your hand. Nina will start calling on you in just a moment. We have one last question here before we start that feature. If the number of coronaviruses rise after opening, which we are basically now, and we sort of touched on this a little bit earlier, does the county have sufficient number of healthcare workers and adequate supply of PPE to handle an increase of cases in the county?
And I sort of already touched, like you said, I did touch on that, but they are in direct contact with the state. Every day they send up their supply, just not the hospitals, but the nursing homes, and everybody has a direct line to the state. They send up what supplies they have on hand, what kind of cases are going on in their facilities, what do they anticipate that they need supply wise for PPE, and they are getting direct shipments from the state. Also on our OEM side, Marty Palugi, the director of OEM, is getting shipments from the state to help provide to the police departments and first responders within our community that way. And again, that is a daily communication back and forth with the state for what we have and what we need. So that is being looked at constantly. And then, like I said, healthcare workers, yes, our healthcare workers are being taxed and stressed, but we have many of our long-term care facilities that have been hit and crippled by Corona have accessed agency nursing and are utilizing that. And we do have amongst our community people agency nurses that are staying in facilities and stuff like that and working from out of state and everything. So we do have continued access to that.
Okay.
And if I could jump into, we through the Office of Emergency Management, we have received many thousands of supplies. I want to say probably closer to 100,000 different supplies, masks, gowns, etc. And we have a good stockpile now on hand. We do share that with the first responders. We share a lot of it with the first responders, but we're keeping a good stockpile here in our own facilities so that if we do have a spike, that'll be our first issue to go to, and then go back to the state and ask for more.
Okay, thank you. So Nina, can we go to the questions, please?
Sure, Vicki. I do have one question queued up, and that question would come from Denise. If she is still wanting to ask her question, go ahead, Denise.
Hi, yes. Let me just start by saying thank you to the Chamber for putting forward just such a wealth of information on all these sessions. Really appreciate you facilitating this to businesses in the community. And also thank you to the Cape May County elected officials and the healthcare workers and the health department. It's really impressive what our little Cape May County has done and what they're communicating, and it makes me proud to live here, so thank you. My question has to do with the workplace. What guidance do you have, and if it's out there, I apologize. And if not, if it's something that could be put together, it would be helpful. If an employee says that they have had contact with someone who's had been either presumptive positive for COVID or tested positive, what recommendation and what guidance should an employer follow? Do we have to tell them to stay home for 2 weeks? Can they get a test? And if so, after how many days of exposure, since exposure? When do we alert the county? Do we alert the county? What are our responsibilities to ensure we don't create a spread at our workplace, and that we, try to isolate any additional positives?
So that goes with our contact tracing a little bit, or sometimes, people come in contact and we don't know. So as an employer, if someone calls you and tells you that they have been in contact with a positive case, they will need to isolate for 14 days. They should stay home, even if they're not sick, because this is where we want to stop the spread. We want them to stay home. What we're typically seeing is between that 6 and 11 day after exposure, and depending on the type of exposure they had, and it would be a close contact, closer than 6 feet, longer than 10 minutes. That's what we consider as an exposure. No mask, all that kind of stuff. Then we want them between that 6 and 11 days where we see them. If they're going to become positive, that's typically where they will become positive. And then we have people on the outliers. That's why we give 1 to 14 days. So we are looking for them to possibly convert in that 14 days. You can have them go get tested. A negative test will only tell them that they are negative at that point in time. So if they went and got tested on day 6 and they were negative, they could possibly start developing symptoms 2 days later on day 8 and become positive. So, that's why that's why we give everybody the guidance. If they've been exposed to a positive contact, we ask them to isolate for 14 days and monitor for symptoms, signs and symptoms. Fever, cough, sore throat. We're seeing GI symptoms, loss of smell and taste. So any of those symptoms, then they would certainly want to report to their primary care physician and get direction from them. But we would also ask them to go get tested.
Okay,
So we
thank
would know.
you. And that's within 6 feet for more than 10 minutes is what if you just talk to your neighbor for 30 seconds in the driveway, you were 8 feet away. Okay.
Yeah.
And does that take into consideration mask use, or no? Is that assuming you have a mask on, or you do not have a mask on?
If you have a mask, if they have a mask on, you have a mask on, your risk is very, very minimal, but it is not no risk, because cloth masks are not really filtering masks and all of that, but it does decrease your risk significantly. So that person would have to sort of deem and make a decision, if they feel like they were in close contact. Was it really long enough? If neither one of them had a mask on, then most definitely If they have a mask on, then that's a decision that you all would sort of have to make and see what you think. But when we say it's not no risk, it's a very, very low risk, but not no risk. So to stop this, we want everybody to quarantine for 14 days.
Okay, thank you.
Thanks for your question, Denise. So we do have about 5 minutes left, not seeing any raised hands. So what I'm going to do is I'll take a minute to scroll through the chat and see if I can find anything that wasn't answered. In the meantime, I do encourage you to raise your hand using the participants tab on your Zoom toolbar. That helps us a little bit just to make sure that we completely understand your question. I see one question in the chat that had been submitted early on that's about modeling. So the question is, what models do you have? What projections do you use about future infections, considering, you know, all the visitors that we're expecting here? Can anybody speak to that?
Really, we depend on the state health department and their guidance through their epidemiologists on what they're seeing. And of course, they look at all the numbers inside and out, including what has happened in China and Italy and Korea and so forth. So we depend on their expertise to tell us which way they think things are going and whether there's going to be a spike coming up or not. So we heavily rely on epidemiologists within the state. So, I mean, that's on a day-to-day basis.
Thank you. Okay, and I'm seeing one more in the chat that I'm not, maybe it was addressed, but just in case, the question is, how many of the community cases came from the long-term care facilities staff? I don't know if that's something that you all have data on or could address.
I'll kind of address that. That's kind of hard. It's hard to, you know, it's kind of like the old chicken and the egg, which came first. We know that a lot of the staff members did bring from the outside, as Mr. Pierson had stated. You know, most of the nursing homes did lock down fairly quickly to outside visitors and all of that. So it would have been the asymptomatic staff that were coming in that, you know, had the virus come into the facility. So, but it's hard to gauge because once it got in there, it spread so quickly. We do track patients and residents, but that information is still ongoing. That's sort of something that will be behind the scenes, and that will come out. The epidemiologists crunch those numbers, and it sort of comes out after the fact once they have all the information gathered and all of that. But it's you know, staff are infecting residents, residents are infecting staff. In our long-term care facilities, you do have some facilities that have the dementia units and stuff like that, and it's very hard to have them follow directions and keep a mask on and stay in their room. And unfortunately, staff does have to interact with those type of patients. So that it's hard. It is a transfer, unfortunately, back and forth.
Thank you.
And it almost it's not quite, I mean, it's hard to separate what staff are working at that facility that are also registered as positives in the community. So filtering out that information is a little difficult. But I mean, you know, we could roughly guesstimate. It almost seems like somewhat like and it fluctuates, maybe 30% sometimes of your staff compared to how many, residents have that virus. So there's definitely, when you have residents with virus, you definitely have staff with virus. We see that, and it's more in the residents, less in the staff. But there's a good group that there's a proportional number that is constant almost. As the staffing virus goes down, also the resident virus goes down. So, but I don't have those numbers in front of me.
Thank you. Okay, I'm not seeing any raised hands, and we're almost at the end of our hour here, so I'm going to turn it back over to Vicki Clark.
Thank you, Freeholder Pierson and Kevin and the team there at the Cape May County Department of Health. This has been a great, informative presentation, and there is one thing here in the chat, and this is the news this morning from the State Attorney General stated that pharmacists will soon start testing. And the question is this planned for Cape May County? And also the hospital stated that they would be ordering, I don't know what this is, Remdesivir?
Yeah.
Remdesivir.
Yeah.
It's a medication. It's one of the medications that sort of they're saying is helping with the COVID-19. So they have it.
It's an intravenous antiviral.
Yes, and as far as the pharmacies, they are starting to do it. Village Pharmacy right up here in Cape May, up in Cape May, God, that's good. Up in Marmora, they're doing this serology testing. Now they're charging for that. However, the state says that they're going to provide free tests at various pharmacies. I know Walmart is going to step up. They're going to do it. CVS's around the country are going to do it. So it's going to happen. You're going to see a plethora of doctors, etc. People take care of the testing because we have to raise the numbers in testing.
Okay.
Just one thing is that the antibody test is also being, you can get the antibody test at any of the urgent cares.
Yes.
The 3 urgent cares in Marmora, Cape Regional Urgent Care at Cape May Courthouse, and in Wildwood. And Complete Care is also doing the testing. There's a wide variety of different agencies out there doing the testing. The state itself is doing all the testing in the nursing homes. The state is providing all the different testing equipment needed, the swabs, the bottles, everything, be delivering through OEM to some of those nursing homes. So that is being provided by the state, not the local hospital. So a lot of those things are being done already. So there's if you need to be tested, you can get tested. I know that there's no wait time in the Wildwood urgent care, so there might be a 1 or 2 day wait if you're non-symptomatic. So there's ways to get tested in Cape May County.
Yeah. Complete Care does it. LabCorp, LabQuest, they all do it.
Thank you. And I know a couple of folks have asked if the governor has accepted the Cape May County proposal. And I know that because our proposal included some dates for opening different segments of business that the governor has not taken action on, that I would say he has not accepted the proposal in whole. So I know that freeholders Maury and Desiderio continue to work with the governor's team with ongoing conversations. So that's all the information I have on that. I don't know, Freeholder Pierson, if you have any more information.
Basically, we were the first county to put into effect a formal plan. Ocean Colony followed, and I believe there was one other county here in Cape and down in the southern end of the state that came up with a somewhat of a plan. But they were most appreciative at the governor's office that we took the time and we did the detail in the plan. No, he has not said go forth and do great things, but I think you'll see that his 3-phase plan somewhat tracks ours. He marches to his own drumbeat, and he has his time frames. And he's focused on the whole state. Well, we're focused on the county. He's focused on the whole state. So his openings and things that will happen will be mostly focused on the whole state coming together at one time. So we're going to continue to go with our numbers and dates in our pamphlet that we put out in our reopening initiative. We're going to continue with that.
Thank you. Well, again, we thank you so much for sharing your valuable time with us this morning and the great information. We'll continue to try to put programs like this together to bring information to the businesses and the residents of Cape May County. Doug, I think you wanted to close with maybe talking about our yard sign program.
Yes, that would be great. Thank you, Vicki. And again, thank you, Freeholder, Pierson, and the entire team over at Cape May County Health Department, Kevin Thomas. You guys, I picked up a lot of information today that, so much coming at us all the time, but still it's very helpful call. So appreciate all the time, all your hard work. Like Mary mentioned, I know you're working 7 days a week, so we thank you for all that. Yes, the yard sign. So a couple things the Chamber's trying to do to kind of highlight the good is to thank our first responders. We have yard signs for sale through our county chamber website. Please go to our website, and the proceeds are benefiting our Cape Regional, the foundation over there. So, great way to thank our first responders. The holiday weekend coming up, so there'll be a lot more folks driving around, and then hopefully they'll see all the support out there. So thank you everyone for the time, and have a safe weekend. We'll talk soon.
Thank you all.
Thank you.